Medicare 101, a guided tour and introduction, presented by Holton Insurance. These are the top 10 Medicare questions. First, we'll define what Medicare is and who is eligible for it. Next, we'll talk about Medicare if you plan to work past 65. Then we'll look at different Medicare coverage options and costs. After that, we will touch on how to choose coverage and explain the different enrollment periods. Last, we will talk about how you may be able to save money and where you can find more information. When we're done, if you have more questions, we will answer those. Let's get started. Medicare is health insurance for older and disabled Americans. It's funded in part by federal payroll taxes paid by employees and employers. The tax is labeled FICA on pay stubs. Medicare is individual insurance. Each person must meet Medicare eligibility requirements as an individual, and each person is covered as an individual. For example, one spouse may turn 65 and enroll in Medicare, while the other spouse is not yet eligible. Medicare is not free. You'll have some costs to pay, which we will cover in a bit. Finally, Medicare is different from Social Security. It's also different from Medicaid, which is health insurance for people with limited income and resources. We'll talk more about that next. Medicare is for U.S. citizens and for legal residents living in the U.S. for at least the previous 5 years. You must also meet one of the following requirements: be age 65, younger than 65 with a qualifying disability, and have received disability benefits for 24 months, or any age with a diagnosis of end-stage renal disease or ALS. Medicaid is a state government program that helps pay health care costs for individuals, families, and children with limited income and resources. Programs and eligibility vary from state to state, but do follow federal guidelines for benefits. Medicaid and Medicare can work together. When an individual has both Medicare and Medicaid, they are called dual eligible. If you have both Medicare and Medicaid, the two will work together and may cover most of your health care costs. Additionally, dual eligible individuals may be eligible for special private Medicare plans. For example, people with Medicare and Medicaid can get a special coordinated care plan called a dual special needs plan. We've covered who can get Medicare, but before we look at what Medicare covers, let's talk about a situation many of you may be in today, working past 65. If you plan to work past age 65, your Medicare decisions may be different. In fact, you may be able to delay Medicare enrollment altogether. This is generally an option for people who work for an employer with 20 or more employees and have employer health coverage that is considered credible by Medicare. Specifically, your plan's prescription drug coverage must be as good as or better than Medicare Part D. People who have health coverage from an employer with fewer than 20 employees must enroll at age 65, or they could face late enrollment penalties. But what about if your health insurance is through your spouse? Well, in this case, you may be able to delay, or you may still need to enroll at age 65, even if the spouse's employer has 20 or more employees. This is because employers can have their own rules for covered dependents. Some employers require covered dependents of Medicare age 65, to enroll in Medicare in order to remain covered by the employer plan. You can ask the employer's benefits administrator to learn about your options for this situation. There are some important things to know about getting Medicare when you continue to work. First off, Medicare and your employer insurance can work together. Medicare will typically be secondary to your employer insurance until you leave your employer or lose the employer insurance, whichever happens first. The Medicare will become primary. Second, if you take any part of Medicare, you will no longer be able to contribute to a health savings account. Think carefully about this if you're eligible to delay Medicare enrollment and are going to keep working. Medicare Part A may seem like a great idea to go ahead and get even if you keep working, because for most people it's premium free. But if you want to keep contributing to your HSA, it may not be the right fit. Finally, Medicare will not cover your spouse or children. If you decide to take Medicare and opt to drop your employer coverage, you'll want to talk to your employer's benefit administrator to understand what options they may offer for spouse or children. For example, some employers may offer COBRA. Make sure you know what dropping your employer coverage for Medicare only means for your family. Let's move on to what Medicare covers. You may have heard about the different parts of Medicare, A, B, C, and D. First, we'll explain Medicare Part A and Part B. Then we'll explain the private Medicare and Medicare-related coverage options, Part D, prescription drug coverage, Medicare supplement insurance, or Medigap, and Medicare Advantage, or Part C. Part A, hospital insurance, covers services provided during an inpatient hospital stay. Most covered services are listed here. This includes your room, your meals, and nursing, and other services. One important thing you may notice missing from the list is doctor services. That's because doctor services are covered by Part B, even when you're in the hospital. Now let's look at Part B, medical insurance. The main covered services are listed here, including doctor visits, the tests or exams your doctor might order, and other outpatient services. Also, we just discussed Part B covers doctor services when you're in the hospital as well. There are a couple things to point out here. First, the annual Medicare wellness visit is an opportunity to meet with your doctor to discuss your health status and goals, things that a regular visit may not provide time for. It's covered 100%, with no copay as long as it sticks to its purpose. If the discussion veers into current health problems like a cough, for example, or if you receive additional services that are not part of the visit like lab tests, procedures, or certain other services, then there may be a cost. It's good to know this ahead of time to prevent any surprises. The second thing to point out is about medical equipment, also called durable medical equipment, or DME. To be covered, the equipment needs to be medically necessary and prescribed by a doctor. It also needs to come from a supplier approved by Medicare. So in most cases, you just can't buy a walker somewhere and have Medicare pay for it. Talk to your doctor first. Here are some additional important facts about Part A. Part A has a premium, but few people pay it. Remember the FICA payroll tax? If you or your spouse paid that for 10 or more years, you get Part A premium free. You can't be denied Part A coverage regardless of your health or financial status, and you're covered at any hospital in the country that accepts Medicare. Finally, you need to know a few terms to understand Part A benefits. Part A coverage and costs are based on benefit periods. A benefit period begins the day you are admitted to the hospital and ends after you have been out for 60 days in a row. Observation status is another important term. Part A covers hospital stays when you are admitted as an inpatient by doctor's orders, not if you're there for observation, even if you stay overnight. Part B would pay some of these costs. Lifetime reserve days are extra covered hospital days you can draw on if you are in the hospital longer than 90 days, the maximum length of stay covered in a benefit period. You get 60 lifetime reserve days. Each can be used only once, but they can be applied to different benefit periods. We'll come back to these terms in a bit when we talk about costs. Here are some additional important facts about Part B. Part B has a monthly premium. If you're receiving Social Security or Railroad Retirement Board benefits, the amount will be deducted from your check each month. Again, we'll talk more about costs in just a minute. Just as with Part A, you can't be denied Part B coverage, regardless of your health or financial status, and you may see any provider in the country that accepts Medicare. Finally, Part B charges a premium penalty for late enrollment, unless you qualify for a special enrollment period. We'll cover enrollment later in the presentation, but for some people, including those who work past age 65, may delay Part B enrollment without penalty. We've gone over what original Medicare Part A and Part B covers. Now let's look at what it doesn't cover. Many people are surprised to learn that they will have out-of-pocket costs, which could be significant depending on individual healthcare needs. Further, there is no out-of-pocket maximum, no financial protection with original Medicare. A serious illness or injury could create real financial stress. Another possible surprise is that Original Medicare does not cover prescription drugs, which can be a big expense as we get older. Other non-covered services include routine dental, vision and hearing care, long-term care such as in a nursing home, custodial care which includes bathing, eating, and dressing and may be called activities of daily living or ADL, and care received outside the U.S. except in limited circumstances. The good news is that there are some options that may help with these non-covered items. Let's explore those now. Even from these simple examples, you can see that Original Medicare doesn't cover everything, and that out-of-pocket costs for healthcare items and services could add up and take a bite out of your budget. The good news is that you have options for other coverage that can cover other key things like prescription drugs, and that may help turn that budget bite into a nibble. On that note, we are ready to talk about what Part D, Medicare supplement insurance plans, and Medicare Part C cover and how they may work with you when you're deciding on what Medicare coverage to choose. You have two options for more coverage. Option 1 is to add Medicare supplement insurance and/or a Part D prescription drug plan to Original Medicare. Medicare supplement insurance will help pay some of the out-of-pocket costs not paid by Medicare Part A and B. Part D will cover prescription drugs. Option 2 is to choose a Medicare Advantage plan, Part C. Most Medicare Advantage plans include drug coverage and may offer additional benefits such as routine dental and vision coverage. Before we delve into these options, I want to point out that all three of these components shown, Medicare supplement insurance, Medicare Advantage plans, and Part D plans, are offered by private insurance companies. What this means in part is that there may be several plans to choose from, and they may vary in coverage and in costs. By contrast, Original Medicare is administered by the federal government, and benefits and costs are the same for everyone. Medicare Advantage and Part D plans are approved by Medicare and held to standards set by Medicare. These private plan options are provided to give you more choices and the ability to fill in for what isn't covered by Original Medicare. Now let's move on to Part D, prescription drug coverage. An easy way to think about this is D for drugs. Remember, drugs are not covered by Original Medicare except in select circumstances. You can get drug coverage in two ways: through a separate standalone Part D plan or through a Medicare Advantage plan. Standalone Part D plans can work with Original Medicare, Medicare supplement insurance plans, and select Medicare Advantage plans, including private fee-for-service plans, or PFFS, and medical savings account plans, MSA, without drug coverage. Each Part D plan or Medicare Advantage plan that includes drug coverage creates a list of specific drugs that it will cover. The list is called a formulary. Every plan must cover a range of both generic and brand name drugs that are generally needed by people on Medicare. Plans also cover all commercially available vaccines that aren't covered by Part B. However, due to the Inflation Reduction Act, beneficiaries with Part D coverage will pay no out-of-pocket for vaccines that are recommended by the Advisory Committee on Immunization Practices, including the important shingles vaccine. Part B covers vaccines like flu and pneumonia shots. Many Part D plans group the drugs they cover into levels or tiers. Drugs in different tiers have different costs. For example, you may pay more or a higher copay, which is a flat dollar amount, or coinsurance, which is a percentage, for a Tier 5 drug than a Tier 2 drug. Also, plans may have a deductible for some tiers and not for others. When choosing a plan, it's important to make sure that the drugs you take are on the plan's list of covered drugs and to understand the costs, which can vary from plan to plan. Each year, the Centers for Medicare and Medicaid Services, CMS, releases a standard benefit for insurance companies to build their plans around. In the standard benefit, there are 4 coverage stages: deductible, initial coverage limit, coverage gap, also known as the donut hole, and catastrophic coverage. The yearly deductible is the amount that a beneficiary must pay out of their pocket before the plan starts to pay their share for covered medications. Deductibles can vary between plans, with some plans having no deductible or limiting the deductible only to specific drug tiers. No plan may have a deductible more than $545 in 2024. The initial coverage limit, or ICL, is a combination of what is spent by the beneficiary and the plan for covered medications. This amount is $5,030 in 2024. The ICL is important because it will determine if the beneficiary will pay for their copay or coinsurance for their monthly prescription drugs during the year, or if they will enter the donut hole where coverage changes. Essentially, you can consider the ICL to be the total retail cost of the beneficiary's medications. For example, beneficiary spent $800 in copays during the ICL, and the plan spent $4,230, totaling $5,030, and now the client enters the coverage gap with only $800 in out-of-pocket spending. Once the beneficiary and the plan have spent $5,030 on covered drugs, they move into the coverage gap, also known as a donut hole. During the coverage gap, they will pay no more than 25% of the retail cost of their covered medications and will pay those amounts until they have spent $8,000 in out-of-pocket costs. Based on our previous example, the beneficiary has already satisfied $800 of that cost during their initial coverage limit. So they would need to spend another $7,200 to move on to the catastrophic coverage stage. During the coverage gap, the amount beneficiaries pay for their medications, the 25%, and the discount they're receiving on brand name drugs, the 75%, will count toward their $8,000 limit. For example, a beneficiary is in the donut hole and has a brand name medication that retails for $100. At the pharmacy counter, they are only spending $25 out of their pocket, but $100 is going toward the $8,000 limit. On the other hand, their $10 retail cost generic is costing $2.50 at the pharmacy, but only $2.50 is going toward the $8,000 limit. Items that count toward the $8,000 out-of-pocket include the yearly deductible, copays and coinsurances, the discount you get on brand name drugs in the coverage gap, the 75%, and what you pay for covered drugs, 25%, in the coverage gap. If the beneficiary has reached $8,000 in out-of-pocket costs, they enter the final stage of their plan, which is catastrophic coverage, and will remain there until the end of the calendar year. During the catastrophic coverage phase, beneficiaries will pay nothing for their covered medications. This is new for 2024. A few final points about Part D. You are eligible to join a Part D plan once you are enrolled in Part A, Part B, or both. Plans often have pharmacy networks that you need to use to get the plan's pricing. Plans may vary quite a bit in terms of what specific drugs they cover and what your costs may be. A final key point is that you could be charged a premium penalty if you are late enrolling in Part D unless you qualify for a special election period. Now we come to Medicare supplement insurance, or what is often called Medigap. Medicare supplement insurance plans are also offered by private insurance companies. As the name says, they supplement Medicare, so they are not Medicare plans in and of themselves. Medicare supplement insurance plans help to pay some of the out-of-pocket costs that come with Medicare, like deductibles and coinsurance. They can only be used with Original Medicare, not with Medicare Advantage. Plans are standardized by the federal government. There are 10 plans labeled with letters, Plan A, F, G, and N, for example. Every plan of the same letter provides the same benefits, no matter what insurance company offers it. Massachusetts, Minnesota, and Wisconsin are exceptions to the rules, as these states standardize their plans differently. It is also important to note that Plan C and Plan F are only available to individuals who are eligible for Part A or turn 65 before January 1st, 2020. Here are some of the costs that Medicare supplement plans may help with and some that they may not. You will see that they help pay for coverage already provided by Original Medicare and may extend it in some cases, as with extra hospital days. Medigap plans can help with Part A deductibles, Original Medicare copays, coinsurance, and provider excess charges, cost of blood transfusions, and cost of foreign travel emergency. Additionally, some programs may cover Part B deductible costs, but only for those individuals who are eligible for Part A or turned 65 before January 1st of 2020. But except for foreign travel emergency coverage, Medigap plans don't fill in for what original Medicare doesn't cover, such as prescription drugs or dental and vision care. Some plan providers may offer value-added services for free or on a discounted basis, but they're not part of the Medigap plan directly. This table may help you visualize, if not read, which costs different standardized plans help with and the level of coverage. 100% means 100% coverage. The main point here is that Medigap plans vary. Now for some fast facts. You must be enrolled in Part A and Part B to be eligible for a Medicare supplement insurance plan, and you must choose from the plans offered in your state. Also, there is a set enrollment period where you cannot be denied coverage or charged more based on your health history. Medicare supplement insurance coverage is nationwide and goes with you wherever original Medicare does. And while plan benefits are standardized, each plan sets its own premium. The amount can vary, even for the same coverage. So you and a friend who lives in a different state may both have Plan F, but your premiums may be very different. In general, though, among the different standardized plans, the broader the coverage, the higher the premium. So for example, Plan A, which we said provides selective help, may have a lower premium than Plan F, which covers more of your costs. Finally, you must continue to pay the Part B premium to Medicare. Part C is Medicare Advantage. It's an alternative to original Medicare and offers another way to get your Medicare Part A and Part B benefits, plus more. You still have Medicare and Medicare contracts with the plan to administer your Part A and Part B benefits. You also continue to pay your Part B premium directly to Medicare. Plans are offered regionally, often in a county or state, by private insurance companies. Most plans also include other benefits like prescription drugs, dental, and vision. All your benefits are covered under one plan. By law, Medicare Advantage plans must provide all the benefits that original Medicare does. Plans combine Part A and Part B coverage in one package. One exception is hospice care, which is covered by Part A even when you have a Medicare Advantage plan. Most Medicare Advantage plans also include built-in prescription drug coverage or Part D. Finally, Medicare Advantage plans may also offer additional benefits, including coverage for dental, vision, or hearing care, as well as fitness programs. The result is an all-in-one plan similar to what you may be used to having through an employer. There are different types of Medicare Advantage plans. Most are coordinated care plans where care is delivered through a provider network. You may get care outside the network, but you may pay more or even the full cost. Most coordinated care plans are HMO or PPO plans. HMO plans have a network of doctors, hospitals, and other care providers you use to receive covered services. POS plans are a type of a HMO plan that also let you see providers outside the plan network for certain covered services. PPO plans have a provider network you can use, but also offer more freedom to see providers outside the plan network for all covered services. Special needs plans are designed specifically for people with certain healthcare needs. The Dual Special Needs Plan we talked about earlier is a kind of special needs plan, specifically for those with both Medicare and Medicaid. There are also chronic special need plans for people who have certain chronic conditions, such as diabetes. Institutional special needs plans for people living in a skilled nursing facility, and institutional equivalent special needs plans for people living in an assisted living facility and need the same kind of care as those who live in a skilled nursing facility. Private fee-for-service plans typically offer more flexibility in choosing providers than other types of plans do. In general, you can get care from any Medicare-approved provider who accepts the plan's terms and conditions. Medicare savings account plans combine a high-deductible health plan with a medical savings account. They generally offer more choice with more financial risk. Here are some additional things to know about Part C. You must be enrolled in Part A and Part B to be eligible for a Medicare Advantage plan. You must also live in the plan's service area, and you cannot be denied coverage. You may pay a premium to your Medicare Advantage plan and continue to pay your monthly Part B premium to Medicare. It's easy to get confused by this. The plan provides Part A and Part B coverage, but you still need to enroll in Parts A and Part B. As we mentioned, you're still in the Medicare program. Medicare contracts with the plan to administer your benefits. Importantly, unlike original Medicare, every Medicare Advantage plan has an annual out-of-pocket maximum for Part A and Part B, services covered by the plan. Once you've paid this amount, the plan covers the entire cost of these services for the rest of the year. Keep in mind, the out-of-pocket maximum doesn't apply to your monthly premium, prescription drug costs, or any costs for additional benefits not covered by original Medicare, like routine eyewear and hearing aids. Medicare sets the standard maximum, but many plans cap your costs below this amount. How do you choose? Let's think about this choice in terms of coverage, cost, and convenience. Coverage. Provider choice is one of the main considerations between these coverage options. Medicare Supplement or Medigap insurance helps pay for care from providers nationwide. Medicare Advantage plans generally have provider networks and each serves a set geographic area. Another key consideration is what you need coverage for. Do you want coverage for prescription drugs, dental, and vision? Questions to ask. Am I able to get most of my healthcare needs met near home? Am I willing to change doctors if mine isn't in a plan network? Do I want coverage for additional healthcare services like dental, vision, hearing, or fitness? The next one, cost. Both options help manage costs, but in very different ways. With a Medicare Supplement plan, you may pay higher premiums than with a Medicare Advantage plan, but other costs may be lower. With a Medicare Advantage plan, you pay copays, but the premium may be low, and you are protected by an out-of-pocket maximum. Questions to ask here are, how often do I use healthcare services? Would I rather pay high premiums even when I don't use services, or would I rather pay copays when I do use the services? What level of Medicare Supplement insurance can I afford? The last is convenience. Many people who opt for a Medicare Supplement plan also buy a Part D plan. With original Medicare, that's 3 different plans. With Medicare Advantage plans, it's usually just one. Questions to ask here is, what coverage option is the best fit for my lifestyle? How do I feel about working with multiple insurance carriers? What Part D plans are offered where I live? What Medicare Advantage plans are offered? Whether you choose a Medicare Supplement insurance or Medicare Advantage, be sure to consider your needs and budget and to compare plans before making a decision. How much does Medicare cost? We'll start with some definitions. Most people are familiar with premiums, deductibles, and copays, which are defined here. Coinsurance may be a less familiar term. It's the amount you pay when the cost of a covered service is split with you. It's determined by percentage. For example, the cost of a service is covered 80% and you pay the remaining 20%. You may have some or all of these types of costs with Medicare, again depending on your coverage. Income-related monthly adjustment amounts, IRMA. You'll pay the higher premium if your income is above a certain amount. The extra amount added to your Part B and Part D premium is called an income-related monthly adjustment amount, IRMA. The amount of IRMA you pay depends on how you file your taxes and your modified adjusted gross income, as reported on your IRS tax return from 2 years ago. Social Security will tell you if you must pay a higher premium because of your income. If you've had a life-changing event that reduced your household income, you can ask Social Security to lower the additional amount you'll pay. When can I enroll? Once you decide on your coverage, you're ready to enroll. So let's explore the different enrollment periods. Most people first enroll in Medicare during their initial enrollment period, or IEP. Your IEP is 7 months long. It includes your 65th birthday month plus the 3 months before and the 3 months after. If your birthday is on the 1st, then your enrollment period begins and ends 1 month earlier. If you qualify for Medicare due to a disability, then your IEP includes your 25th month of receiving benefits, the 3 months before and the 3 months after. You are enrolled in Medicare Parts A and B automatically if you are receiving Social Security or railroad retirement benefits at age 65. You'll get your Medicare card in the mail. Otherwise, you need to sign up yourself online, on the phone, or at your local Social Security office. During your initial enrollment period, you can also enroll in additional coverage: Medicare Advantage, Part C, a Medicare prescription drug plan, Part D, or Medicare supplement insurance, Medigap. To get any of these three plans, you need to enroll directly with a private insurance company offering the plan. A final note: you may refuse or delay Part B enrollment and take just premium-free Part A. This may be a good idea for people who have employer or other credible coverage. Some employers require you to take full benefits, your Part A and Part B, at age 65. You also may join a Medicare Advantage or Part D plan during your IEP if you're eligible. Ensure if you decide to delay that doing so won't mean paying late enrollment penalties later on. If you miss your IEP, don't panic. You have another chance to enroll, called the General Enrollment Period, or GEP. The GEP is January 1st to March 31st every year. You can enroll in Part A, Part B, or both. If you're eligible, you can join a Medicare Advantage or Part D plan until June 30th of the same year. Late enrollment penalties may apply depending on your timing. Again, we'll get to that in a minute. You must be enrolled in both Part A and Part B to be eligible for a Medicare supplement insurance plan. You are not subject to medical underwriting for 6 months after you enroll in Part B at age 65 or older. You can still apply for a Medicare supplement insurance plan after this time period, but you may be denied coverage or charged more based on your health history. Some states may allow for additional open enrollment periods, such as under Illinois Senate Bill 147, also known as the birthday rule. This provides that if an individual is at least 65 years of age, but no more than 75 years of age, and has an existing Medicare supplement policy, the individual is entitled to an annual open enrollment period lasting 45 days, commencing with the individual's birthday, and the individual may purchase any Medicare supplement policy with the same issuer that offers benefits equal to or lesser than those provided by the previous coverage. Provides that during this open enrollment period, an issuer of a Medicare supplement policy shall not deny or condition the issuance or effectiveness of Medicare supplemental coverage, nor discriminate in the pricing of coverage because of health status, claims experience, receipt of health care, or a medical condition of the individual. We talked about working past 65 a bit earlier and how you may be able to delay. If you qualify, Medicare provides a special enrollment period for people who work and have employer coverage past age 65. You have 8 months to enroll in Part B and Part A if you haven't already. You may enroll in a Medicare Advantage or Part D prescription drug plan within the first 2 months. It's important to pay attention to this timing. As we've mentioned, both Part B and Part D charge late enrollment penalties. The Part D enrollment deadline is especially important since it happens quickly and can sneak up on you. One more thing, make sure your employer provides you with proof of credible drug coverage. This means it's at least as good as Part D provides. If your drug coverage doesn't meet the standard, you could be penalized. Remember that your 6-month Medicare supplement open enrollment will be triggered once you are enrolled in Part B. Also, you must be enrolled in both Parts A and B before you can enroll in a Medicare Advantage plan. Part A, Part B, and Part D may charge late enrollment penalties. The Part A penalty doesn't apply to many people since most of us get Part A premium free. But for those who have to pay, the penalty is an additional 10% of the premium amount. You pay the penalty for twice the number of years you could have had Part A but didn't sign up. The penalties for Part B and Part D could apply to more people. It's important to understand the enrollment periods we just discussed and to enroll on time to avoid them. The Part B penalty is an additional 10% of the premium for each full 12-month period you could have had Part B but didn't, unless you qualify for a special enrollment period. You pay the penalty for as long as you have Part B. The Part D penalty is an additional 1% of the current average plan premium for each month you're late. You pay the penalty for as long as you have Part D. Remember again, you need to have credible drug coverage, as good as Part D, to avoid this penalty if you enroll after your initial enrollment period. Medicare is not a one-and-done decision. Things may change in your life, your health, your finances, or even in Medicare or your plan. It's important to review your coverage every year to see if it'll work well for you going forward. You can change your coverage choices if you decide to during Medicare annual enrollment, which is October 15th through December 7th every year. The new coverage goes into effect on January 1st. The Medicare Advantage open enrollment period is specifically for Medicare Advantage plan members and runs from January 1st to March 31st. You must be a member of a Medicare Advantage plan on January 1st to be eligible for this enrollment period. During this time, you may switch to a different Medicare Advantage plan or drop a plan and go back to original Medicare, Parts A and B. If you return to original Medicare, you may also enroll in a Part D plan until March 31st. You may enroll in a Medicare supplement plan as well. You may only make one coverage change during this enrollment period. The next opportunity is the fall annual enrollment period, unless you qualify for a special enrollment period. Medicare offers a special enrollment period, or SEP, for qualifying life events. This is for those times when life doesn't happen on Medicare's schedule. Certain situations, such as moving to a new home or certain changes in your healthcare coverage or health, can qualify for a special enrollment period. In most cases, you have 2 months from the date of a qualifying event to make coverage changes. During a special enrollment period, you may join, switch, or drop a Medicare Advantage Part C or prescription drug plan Part D. However, there may be some restrictions depending on how you qualify for the SEP. Where can I go for help? If you need it and you qualify, you may be able to get help paying some healthcare costs. There are several programs as shown here. It's worth asking about them, even if you think you won't qualify. A good place to start is with your State Health Insurance Assistant Program SHIP office. You can find the number at shiphelp.org or by calling Medicare at the number shown. You can also find helpful information at Medicare.gov, the official government website for Medicare, or you can call Medicare at the number listed here. You may want to talk to your State Health Insurance Assistance Program to see if you qualify for any financial assistance, or contact Social Security or your state Medicaid office to learn about other assistance programs. Thank you so much for your time today.